All right, the last section. Welcome to section 8 of chapter 34. We are almost done, guys. Hang in with this chapter just a little bit longer. All right, so right off of SIDS, we start with the assessment and management. Victims of SIDS commonly will be pale or blue, not breathing, and unresponsive. Okay, they're going to be in cardiac arrest. We're not sure of the causes. Some causes can be attributed to respiratory issues. They may have been laying in an improper format. They may have gotten a blanket against their face and suffocated to death. It may be congenital. There may be an underlying cardiac problem that nobody knew about. We just don't know. As you may remember from the previous section, SIDS is defined as when there is no clear cause of death after an autopsy has been performed. So, management should be focused on necessary interventions. Depending on how much time has passed and any obvious post-mortem things that you see, will determine whether or not you're going to attempt to resuscitate. Just like with an adult or any other child, if they're obviously deceased, then we are not going to do anything. We're going to tell the parent, unfortunately, that their child has died, and focus on care for the family. So you need to know how much time has passed since they were last seen normal. Do you see signs of lividity? Do you see stiff, cold body? If you don't see post-mortem changes, begin CPR. And if you're in doubt, begin CPR. Okay? Note any marks or bruises on the child before you begin. That can be signs of child abuse. An injury that was administered to the child that resulted in this circumstance. Okay, and then note anything that was done before your arrival. Did they attempt to do CPR before you got there? Were there any other interventions that took place? Carefully inspect the environment. Note objectively what was found, where the infant was found, the position that they're in. Were there any signs of illness? How did the house itself look? Was there poor hygiene? Was the family behaving as you would expect on the death of an infant? And where exactly was the infant discovered? And were they moved prior to your arrival? However, under most circumstances, without child abuse, this is absolutely devastating. This is unexpected. This is something that's going to provoke a very strong emotional response, not only to the family, but to you. Okay? It is okay. It is okay to not be okay after one of these incidents. Utilize whatever method that you need to, within reason, within healthy reasonings, of course, to express grief, and allow the family to express grief. Okay? Know that they may lash out at you. They're grief-stricken. They're upset. It's not personal to you, despite what they may say. It's not personal. You didn't do this. Keep that in mind, and you did the best that you could. And like I said, it's okay to not be okay. In addition, anytime that there is death of a child, you move from supporting the patient to supporting the family. The family may not want you to initiate resuscitation. This may conflict with your EMS protocols. Involve medical control early. I think Zoe knows that I am distressed talking about this because she is literally climbing up. She is climbing up my chair. Introduce yourself. Ask about the child. Ask about their demographics. Ask about their medical history. These might give you signs and symptoms and things that can help you explain what happened. Tucker is here too. All right. Don't speculate on the cause of death, though. Okay. They may ask you what happened. You have to tell them you don't know the vast majority of the time. Allow them to hold the child if they need to say goodbyes. Ask them whether or not they want to. Some may not. Things that you should do is always use the child's name. Don't say your child. If you don't know the child's name, ask them, what is your child's name? And then, unfortunately, little Johnny has died. It is best to be direct. Use these final phrases like died and dead instead of passed away or gone. The last thing that you want to do, because they're going to be grasping for something. I have had patients, mostly adult, fortunately, that I will tell them, I'm sorry, your loved one is gone. To some people, that may not be as final as it is to us. And we're trying to be nice, but you need to use these final phrases. You need to use died and dead. That will actually help them along that grieving pathway. Okay? Don't ever, unless you know how they feel, don't tell them you know how you feel. Acknowledge their feelings. Okay? Support them, empathize, but unless you know how it feels to be in that situation and lose a child, don't tell them. If you do know that at some point, I hope you never do, but if you do know that, you can tell them that, and you can help sympathize and empathize with them on a completely different level. But most of us don't. So don't tell them you know how they feel unless you absolutely do. Offer to call people. Ask to call their church if there's anyone you need to get a hold of. Keep things short and to the point. Avoid long descriptions about what happened. That's not important at this point in time. Ask them if they want to hold the child. Stay with the family while they hold them after it's wrapped up, but do not attempt to remove anything that was used in resuscitation. Most places, in New Mexico it is this way, any unattended or unexpected death is considered a crime scene. So OMI and the police department will have to take care of that, and we do not move those things unless you absolutely have to. Remember that people express grief differently. You may wind up with another patient because of the extreme grief that someone's going to. Okay, and a lot of the times the caregivers will feel responsible for what happened. They're going to be beating themselves up. What did I miss? I could have done this. If only I had checked on them sooner. There's no proof of that. Okay, you need to manage those patients potentially as psychiatric emergencies because of this. So don't be afraid to deal with the patient, the parents, the caregivers, whatever, as a separate patient. Okay. Some EMS systems do arrange for home visits after a child's death, but you need to be trained on that. You don't want to just show up after your shift, to these places. That would be inappropriate. So, as far as dealing with for us as the responders, as I said before, it's okay to not be okay. The death of a child is extremely stressful. This is something that will affect you profoundly. Okay? Talk with someone about it. Talk with other people that were there. Most places here in Albuquerque, we do this. We do a debrief. It can be immensely helpful to talk through, and because you're going to be beating yourself up probably. You're going to think about, what else could I have done? Should I have done something different? Could I have done chest compressions better? Could I have resuscitated, or did I miss something? Okay, talk through these things. If you need additional help, seek that help out. Okay, we don't want to become a victim to suicide in our own profession again. And this is something that is so emotionally stressful to us as rescuers that we need to be aware that you have to not only check in on yourself, but check in on your partner, check in on the other crew members that were there. You might just save a life. The final thing that we're going to look at here is something called an ALTI, a apparent life-threatening event. These are children that may stop breathing, that may become cyanotic, they become unresponsive, may look like they have coded, but it's something that resumes. Okay, with stimulation, they usually start breathing again. Their color comes back. These are called apparent life-threatening events, or ALTIs. The classic ALTI presentation is a change in muscle tone and they're choking or gagging. So after an ALTI, they can pop back up to perfectly normal. Okay, with no signs of distress, no signs of cardiac arrest, no signs of difficulty breathing. However, these are patients that we should absolutely transport to the hospital to make sure that there's not something underlying that needs to be detected. There's not a brain tumor. There's not an underlying cardiac problem. We need to pay attention to airway management in these, and the history around it may shed some light on what happened. Was this a SIDS event that was detected midway through and then sufficiently resuscitated from? Or is this just completely unknown and they're going to need further investigation? Allow the parents, policy and protocol allowing, to ride in the back of the ambulance. Okay. We don't know the causes of these for the most part. So avoid speculation. Allow the physicians to be the ones that talk to the parents about that. And be upfront. Don't lie to the parents. Don't say, well, it could be this, it could be that, it could be this, it could be that. We don't know. Okay? In these ALTI events, they don't have a direct cause. So be aware that that might not be a question that you can answer. All right, guys. Congratulations. We are here at the end of chapter 34. Zoe is also very happy about this. She's still down here. So, guys, thanks for dealing with me, and I'll see you guys in the next chapter.